Okay, last meeting we talked about psychological disorders. Which one was your favorite? Which one did you find most interesting from the psychological disorders that we talked about? Which one related to you the most because you have it or a loved one has it? I know someone is married to someone with OCD.
You have to do survey on that.
Which one?
I said you have to do survey on that. So
I know, it's interesting, right? But it's not impossible to treat or manage psychological disorders. Some are not curable, but they are manageable. So this is our topic for today. And these are different ways to treat a disorder. Obviously, psychotherapy is the most controversial because you have to submit dream journals, dream diaries. We're going to talk about the process as we move on from one slide to another. Biomedical, because not all disorders could be cured by therapy. You have to take some medications. And the goals of the psychodynamic approach, this is by Freud, is to dig deeper from your past. What is causing you this type of disorder? Okay. So, if you are using this approach, at this time of Freud, it takes years and years, lengthy and really expensive sessions. But the contemporary psychodynamic approach lasts only for about 3 months or maybe 20 sessions. It's not as long as it used to. So Freud said, you look at what the defense mechanism this patient or client is using. We talked about defense mechanism 2 weeks ago, didn't we? Can you give me an example of a defense mechanism aside from repression? This is when you try to forget things that gives you a negative emotions. Denial is one. What else? Regression. You go back to a happier stage in your life. You become childlike or you curled up in a position like a fetus to cope with your frustrations. Which one is the most commonly used by many people? Repression is motivated forgetting. And denial. Yes, we also do sour graping. Remember that? Sour graping and sweet lemonade to cope temporarily. But for those who are using defense mechanism for a long period of time, that means something needs to be discovered. Something happened from the past, so you go back to an earlier stage in life, particularly childhood. So the free association, you've seen this in movies or TV shows. This is when the patient or the client is on a couch, and then they are asked, just tell me anything that you want to say. Client is free to say anything in their mind. So let's say the psychotherapy says, tell me about your father. And then this patient now can say anything for 15 minutes or so. And then the psychotherapist is writing down or recording the response. The dream interpretation, I talked about this already. You are required to write a dream diary every day. Because according to Freud, your dreams are the expressions of your rejected desires and motivations. You reject them when you're conscious because you feel guilty. So they go to your unconscious mind, and your unconscious mind operates when you are sleeping. What are you so busy about there, Michael?
Oh,
The lecture?
yes.
Okay. Because I don't like students doing homework for other classes when they are in my class. Did I tell you that?
It's cheating.
It's cheating, right? You're with me and you're thinking of somebody else. Yes. So the manifest content is the actual content of your dream. So for Freud, if you are dreaming of a snake, for instance, that's the manifest content. The latent content is the underlying meaning of the snake, which is, if you're a follower of Freud, that is a sexual desire for a male individual. And the resistance is also something that the therapist is watching. What is resistance? For instance, the client was asked, tell me about your boss. And then the client says, why don't we talk about my wife instead? It's you diverting the topic to something easy, visible, obvious, that the therapist, doesn't need to. Or the client misses the appointment, or they are late half an hour to shorten their session with you, or to avoid their session with you. So that is what we call resistance. Now the transference is when you transfer the feelings towards the therapy, when the therapist says, pretend I'm your husband, talk to me. So you could swear, you could say anything you want to say, because you are transferring your emotions to this person, causing the problem to the therapist. Am I clear? Okay, so that is Freud. So I was saying the more modern approach are not very long, like the traditional psychotherapy approach. So these are the criticisms. I'm not going to include this in the test. You could just read this on your own. For every approach, there is always a criticism. And it's not for everyone. If this didn't work for you, try another one. There is no definitive therapy that says, I'm the best approach. No, it depends on the person. Now, this behavioral approach, this is what you learn, right? You learn your behavior. If you learn it, you could unlearn it also, correct? This is why you go to, where do you go when you want to change your behavior, if it's intense or severe? You go to rehab to forget your old behavior and learn new behavior. Okay, these are the different techniques in unlearning habits or bad behavior. The aversive conditioning, you have to pair this pleasurable addiction of yours to something negative. So for instance, you love drinking. You take medications that makes you vomit after you drink until you learn this is not pleasurable anymore. Remember the smoking that I said? You smoke 2 packs until you vomit. Next day you don't want to smoke anymore. That is an example of aversive conditioning. Now the systematic desensitization, this is most effective to people with test anxiety. You need to teach yourself how to relax. Is that possible? Is there anyone here who suffers from test anxiety? Because it's real. You can't breathe, you're sweating, you're very nervous, you feel like the world is closing on you. Relaxation is the key word here. If you teach yourself to breathe before you answer a question, you need to pause, you need to give more time for yourself. That's an example of systematic desensitization. Now the flooding treatments, you face your fear. So for instance, you have a fear of height, you go to Palm Spring and ride that. What is that? How do you call that ride at Palm Spring? It's really high, right? Maybe, I don't know the name. But I went there to conquer my fear for heights. And I was scared of cadavers because I was a medical student. Did I tell you that? I passed out. It was the first time I got kicked out from the program because I passed out the first time I saw the cadaver. Remember, it's in the Philippines, it's in the 80s. They smell bad, they look, horrible. So as soon as I opened the bag, I literally passed out.
Oh my gosh.
And the dean told me, you can't be a good doctor. I'm a doctor now, so it's okay. So I went to this exhibit, those body exhibits?
Yeah.
I think Dr. Yusef required his student to go there. So I went there just to face my fear. So you have to conquer expose yourself to something you're scared of. So if someone is scared of spiders, for instance, what you need to do is to, through repetition, look at the picture. Because those who are intensely scared of spiders, they can't even look at the picture of spiders. So after you get used to it, you now see a spider at a distance. Then you get used to it, you now go near. They put spiders in aquariums, right? So you go near, and then after you are used to it, then it's time to hold it. Do you think it's impossible? It is possible. Okay, if you're scared of flying, for instance, what do you do? Is it me or is it warm? It's okay?
Alright, so I need my, you can't listen to her.
Defense.
She's always got a cold, you can't listen to her.
Okay, so let's say you're scared of flying. What do?
You fly again first?
You go to the airport first, right? And then after you get used to that, you go near the plane, inside without flying. After you get used to it, you fly. I think Whoopi Goldberg did this treatment because she is very scared of flying. So this is another way to get rid of a bad habit. Let's say you are trying to make your family listen to each other as you have dinner. So everybody submits their cell phones, right? Whoever gets their cell phones first washes the dishes or pay the bill if you are eating out at the restaurant. That's a token system. You have a swear jar. You know what that is? You want to get rid of swearing in your family. So everybody pays, or in your company, everybody pays $1 every time they swear. And those money goes to the person who didn't swear at all. Can you give me your own example? Have you heard of the Biggest Losers contest in every company? They pay $30, for instance. They do measurement. And then after 3 months, they measure each other again. Whoever lost the weight the most gets the money. We had that here. I never joined, I never win. But Johnny, our maintenance guy, won for, I think, close to $2,000. That's a token system, yes. Sometimes if your kids are teenagers or older children, such as 10, 11, those are the difficult stage to make them behave, you could do contingency contracting. You write contracts. If I violate this is what's going to happen to me. Could you do this to your spouses? Yeah, you could do it also. And then the observational learning, this is the easiest. You just observe someone who's not scared of spiders and you learn why is she not scared. So you observe someone who's losing weight the way you want it to be. Then you could watch as they exercise, as they do portion eating. So that's the cheapest actually. You don't have to pay anyone. And these are the good and the bad on the other side. So this approach pertains to what? What is cognition again? Thoughts processing. So in this approach, you just change the way you think. You define things, the way you see happiness and things like that. So you change your belief system, in other words. What is the most faulty belief system that sometimes hurt us without us knowing it? Do you have a belief system that hurts you the most or sometimes makes you suffer? If pleasing everyone is your belief system, are you going to be happy?
No.
Because you cannot please everyone, right? Making everyone happy is impossible. There's always someone who is not going to like you. I had this conversation with a colleague here at this university, Every time we get the FC's result, we get it the next term, not during the term. So we can't do revenge or anything like that to a class who gave us really low scores. And this person is always complaining and very, very upset. So I told this person to, why don't you just accept? Not everyone is going to like us. If 40 students like you and 5 lazy students do not like you, so be it. And I hope I was able to help this person change through this treatment. Yes?
Now, how do you convince or teach the adaptive ways of changing a dysfunctional belief, like for example on a child, when they're growing between being a child to being a pre-adolescent or a teenager, their mainly way of thinking is, I want to be liked by everybody in class. And I do notice that there are kids that still have that playfulness, and then there's other kids that are already growing up too fast and they want to be teenagers and they're gossiping and all that. How do you convince that other child that it's not, you don't have to be like that?
You start early. That's the best. But if you didn't start early through behavior and cognitive approach, they always be together in many ways. They are the best when they work together. Behavior, cognitive approach, repetition. Because sometimes once when you talk to your child, one talk is not enough. You have to repeat it again and again. And of course, you should serve as a role model. You can tell your child, be confident, and then you complain, oh, I look so fat in this dress. I mean, that's not going to work. Okay. And, did I miss anything? Okay. So, the rational emotive therapy says, again, change your belief system. For instance, you got a breakup. What do we usually believe? I'm never going to be loved ever again. I'm going to die. I can't live without him. Right? Don't we feel like that at the beginning? And of course, if you don't change that irrational belief system, that could lead to depression. Depression could lead to suicidal tendencies and all sorts of unhappiness. Is that possible to change your belief system in this? At the beginning, let yourself grieve. Let yourself say, it's the end of my life. And then bounce back after a week. A week is the longest. You should not wallow in your loneliness when someone leaves you. Because not everyone is going to stay in your life. There's always an ending. It's either this person lives or this person dies. I mean, there's always an ending. I'm not a very pessimistic person, but just enjoy it while it lasts. Okay, again, those are the benefits and these are the criticisms. So let's talk about humanistic approach. What is this again? What is humanistic again? You have the free will, yes, to be in control of your life. Self-actualization is the highest fulfillment because it has something to do about contentment. Be content with what you have and with who you are. For you to be self-actualized, do you need to have achievements, so many achievements in life? No, this is what we were talking about before, right? You just have to feel it in you, authentically, not faking it. So, you need to want to change. Otherwise, if you don't own your behavior, how can you get help? I'm not an alcoholic and just drinking as soon as I wake up. I'm not an alcoholic. I just drink when I'm, every time I feel like it. So you have to know you have a problem. So this is, sometimes you are not aware of the name, but this is what you see in the movies when the therapist says, uh-huh, and then the client talks, I see, and then the client talks. So what do you want to do now? And then the client, you just help the client arrive to a decision or a solution to his or her problem. Have you had this type of therapy? Like you are the one talking and you're the one solving your problem, you are just being guided. Okay, and again, those are the criticisms. Now, so let's talk about interpersonal therapy. Can you give me an example of this? Is marriage therapy an example of this? Marital family therapy?
Yeah.
Yes, because it teaches you how to deal with the people around you. Okay, when you say group therapies, it involves more than one person. And there are group therapies that are led by professionals, licensed professionals such as marital and family therapists. There are also group therapies, these are the self-help group, that do not need any licensed professional. It could be a counselor, it could be someone who experienced the same difficulty and was able to cope with it. So let's talk about that. When you are doing a family therapy, do you see them every time, all of them in one session? Is that effective? Yes or no? At the beginning, yeah, so you know what's going on. And then you have to do sessions separately until you figure out, oh, this is the problem. This is the cause of the problem. And then you put them together when every issues are resolved. So it's not always a group session all the time. This is what I was saying. An example of this is AA, Alcoholic Anonymous. There is not always a therapist involved there. Someone who's experienced, someone who's able to conquer alcoholism. Bereavement group also is an example of a self-help therapy. Okay, this is what I want you to think. Is it true? In some cases, you just have to try your best on your own. Is it possible?
Yeah.
Let's say you have a problem with your study habits. Can you change on your own? Procrastination, for instance. You have to want to change. You have to acknowledge, I have a problem, and then try.
Unless they have ADHD.
Of course, that's a different issue. If you have a disorder, behavior, cognitive therapy, behavior modification is the best. But if you don't, it's going to be more effective, right, if you use it. Okay. Just read that on your own. As I said, there is no single therapy that is the best for everyone. But if you're asking my opinion, is behavior cognitive therapy is the most successful. Okay, so let's talk about drugs. Because not all therapies work. To some people, like people who have bipolar disorders, therapy is not enough. You have to have some medications. So the antipsychotic drugs, Seroquel is an example. It brings you back to reality because psychosis makes you lose contact with reality. You're agitated, you're paranoid. So if you take any of these medications, you see this probably in TV commercials, you are going to go back to reality. It brings you back. It makes you realize, oh, I am in the classroom. I need to study. Now, the antidepressant drugs are given to people with depression and bipolar disorder. So you see all these examples here. So what is reuptake again? Do you remember? Serotonin makes you happy, right? This is a neurotransmitter. When it's passed from one neuron to another, it will be good. But reuptake, what is that again? Reuptake inhibitors. This is when what part of the neuron absorbs everything back and brings the chemical back to the nucleus of the cell. That is terminal bonus. That's where it happens. We are reacting. The terminal bonus. They're the one that releases, right? So instead of releasing it, it's absorbing everything back. So there's no serotonin if reacting happens. So this is also given to bipolar disorders because they are not always elated. They are sometimes on the opposite of the spectrum. So this is allowed if you have test anxiety. They're allowed in the test, board exam, for instance. If you are diagnosed with severe test anxiety, yes, you could be prescribed with Valium. So ECD is going to be recommended if therapy and medications didn't work. Have you seen, what is that movie? I forgot the title. Jack Nicholson, very classic movie, old one. What is that?
As good as it gets.
No, it's not.
One Flew
It's
Over
an
the
older
Cuckoo's
one.
Nest.
He was a mental patient.
One Flew Over the Cuckoo's Nest.
Yes, that one. So there was a scene with ECD. It is stigmatized. This is very scary. A changeling. Have you seen that? Angelina Jolie.
Yeah.
It was used to punish women, right? So, but it's not true. ECD is very helpful to some patients. I have a video to show everyone.
Just look at me.
What about you that's different?
Everything. I smell.
You have a body odor?
My hair's falling out. I'm disgusting. I'm evil.
In fact, you think that you should be dead. Did you try to kill yourself? Did you really?
What?
Tell me about it.
Took a bunch of pills, aspirin,
When was this?
on Thanksgiving.
When Mary attempted suicide, it opened all her feelings to the world. They now were expressed in all their intensity. She was worthless, hopeless, life was not worth living. She felt she was the devil, and she had the idea that the only way to end this terrible pain was suicide. She tried at home. Her husband brought her right to the hospital, and from that moment on, she had to be monitored. We had to have an individual sit with her 24 hours a day, because all she could think of was trying to kill herself. There were hours in the next few days that we had to put Mary into restraints. The alternative was that she would scream and try to kill herself by any device possible. It became necessary to treat her as rapidly and as effectively as we knew how, for this drive to suicide and this very severe feeling of unhappiness.
Mark, clean your head off with water.
At the beginning of ECT treatment, the patient is put to sleep, and 30 seconds later is given a dose of muscle relaxant.
The Brevitol's going in. Nice deep breath.
We found that she had
The lid reflex is gone.
cup is up.
Bite block is in.
Chin up.
Repeat it slow. Okay.
At At that point, electric current is passed through the brain for a duration of half a second to 4 seconds. Typically, 6 to 10 treatments, spaced over 2 to 3 weeks, will be given. ECT produces a seizure, which needs to last for 25 to 120 seconds to be a good or effective treatment. After ECT treatments, patients will show confusion and loss of memory for recent experiences. Both of these problems clear up, and permanent memory problems after ECT are rare.
Mary, open your eyes. Treatment's all over with.
In Mary's case, medication did not help, and so electroconvulsive therapy was the best alternative. After treatment, Mary discussed her recent depression with her doctor.
The depression that I came here with, I don't really remember much about.
Remember nothing about it.
I do remember going home being in the hospital here and going home on Thanksgiving and taking a lot of aspirin. I remember that.
What happened on Thanksgiving?
I remember thinking I was the devil. And taking aspirin, and then my son coming from my neighbor's house and coming into the bedroom, and then I remember feeling bad that I had done that because I didn't want to die and leave him. And then I told him to go tell his father that I had taken a bottle of aspirin.
Electroconvulsive therapy has a very important place in the treatment of certain depressions. It's not a panacea. It doesn't help everybody. But it remains a very effective way for quickly reversing severe depression.
Okay, so I have a video here of the exposure treatment for an animal phobia. Did I show this to you?
It's now time for Marvin's exposure, and I'm really worried about the next level for him.
So, as you can see, we are here in the beautiful Golden Gate Dog Park. You don't go to parks, do you? Why not?
No.
Why?
They're dog friendly.
Well, that sounds like a good thing.
To you, not to me.
Okay.
This exposure is going to bring up a lot of pain and memories from the past.
Oh, hell no.
Hey, Marvin, stay with me.
This big old puppy comes on a corner. My heart, that almost jumped out of my body.
Stay with me. Stay with me. You're okay. You're okay. Stay with me. Let's do this together. You're good. You're in control. You're backing up. You're running from your fear. We'll let the dog get closer to you, but I don't want you to back up. This dog represents 40 years of being in pain. So can I let the dog come closer?
A little bit.
Okay? Okay, you tell her when to stop. I'm gonna let you tell her, okay? Alright. Do not look away from the dog, okay? Go ahead and come a little bit closer. Think of your family who is not going to want you to suffer. And kiss your pet to death.
You know, keep looking at me. No.
Marvin, come on, Marvin. Think of your girls. Think of your girls. Think of your girls. You're not a coward. You are not a coward. You are a strong person. You're not a coward, Marvin.
I close my eyes and I go back in time, like where I was when I was 5 years old.
This is why you're confronting your fear, because you can't keep living like this. You can't keep living in sheer terror. Enough is enough.
Babies.
I know.
With my babies.
I know.
So much.
You cannot leave being afraid still. I know you're going to be scared, but you have to touch the dog before you leave. I'm sorry. Walk up to the dog. Let's see you shaking.
Oh my God.
Look at you.
Dog. Dogs know fear, they go after fear.
I know it's tough, but you're moving forward. You're regaining your life.
Okay. Did you notice it's not just behavioral, it's also cognitive at the same time? Because she was saying, think about your daughters. Which one do you prefer? Oh. Okay. Is that okay? I need to be seen in the video though. That's why I need some time. Now, this is the second option if medications and therapy do not work. And if all of those three do not work, this is the last resort, which is a brain surgery. As you know, as delicate as the brain is, you're trying to fix one, you destroy another one. So it's not always recommended. The gene therapy, this is in the hope when you inject stem cells to a person, this cell repairs the damaged gene. So, as I said, there's no guarantee 100%, we're not there yet. And the most simple one is when you, where is that? There. The transcranial magnetic stimulation, we've talked about this in the first day of class. You see the brain in 3D, and you can change some electrical circuit in the brain doing that. Okay, so what do you mean by this? The institutionalization of the mentally ill.
Bring them back into the bubble.
Bringing them back to the community. So they stay in a home instead of putting them in a mental institution. There were a lot of scandals about having mental institutions in the United States. Patients were abused, patients were neglected, and the government was paying more money for these patients. How much do you think they were paying for people to go, people with mentally ill go to an institution every year? Any idea?
Multiple billion.
Per person. Per person, it's about 70 to 80,000 per year if they are in institution. Now, if they are in a home, the government only supports about 36,000 a year. So it's reduced by more than half. So the government saves money, and we have to take care of our mentally ill, because if we don't, what kind of a country we are, right? Actually, the mental health is not fully supported in this country. That's why people are killing randomly. These people are not mentally ill people. I'm not talking about the terrorists, okay? I'm talking about the unsafe individuals who need some mental care, health care. That's it for this chapter. So I would like you to put your thoughts together. I'll be back. I'll print out the paper for you to use in the group contest. Okay, so 5 minutes. It's not open notes.